What is an aneurysm? Every day, blood travels through our bodies using an incredible network of vessels, arteries, and veins that act like highways, delivering oxygen and nutrients to every organ. Vessels are strong, flexible, handling blood pressure. But sometimes, one area of a blood vessel wall becomes weaker than the rest. And under constant pressure, that weak area can begin to bulge outward. This balloon-like bulge is called an aneurysm. Think of a garden hose. As water flows through it, the hose stays firm and round. But if part of the hose wall gets thin or damaged, a little bubble forms. That bubble is more likely to tear if pressure builds. An aneurysm behaves the same way. Aneurysms can form in different parts of the body, but the most common places are the brain, called a cerebral or intracranial aneurysm, the aorta, the body's largest artery, running through the chest and abdomen, other arteries, such as those behind the knee or in the spleen. Each type of aneurysm acts a little differently depending on where it develops. So what causes the blood vessel wall to weaken in the first place? There isn't just one cause. Instead, it's usually a combination of factors like high blood pressure, which puts constant pressure on artery walls, smoking, which damages the lining of blood vessels, atherosclerosis, or plaque buildup that stiffens and weakens arteries, age, as blood vessel walls naturally lose elasticity over time, family history or genetic conditions, which may make some people more prone to aneurysms. These factors don't guarantee an aneurysm will form, but they increase the likelihood that a vessel wall will weaken. In many cases, aneurysms grow slowly and silently. People often don't feel symptoms until an aneurysm becomes large, or if it begins to leak or rupture. When symptoms do appear, they depend on the location. For example, a large aneurysm in the abdomen may create a strong pulsing sensation. A brain aneurysm might cause headaches or vision changes. But again, many aneurysms cause no symptoms at all, which is why they're sometimes discovered by accident during imaging for another health issue. The most serious concern with any aneurysm is the risk of rupture. A ruptured aneurysm is when that weakened, ballooned area tears open, allowing blood to escape into surrounding tissues. In the brain, this can cause a type of stroke known as a subarachnoid hemorrhage, an event that requires emergency medical attention. In the aorta, a rupture can cause massive internal bleeding, which is also life-threatening. This is why early detection and monitoring are so important. Fortunately, not all aneurysms are dangerous. Many stay small and stable for years. When doctors find an aneurysm, they look at its size, shape, and growth rate to decide the safest plan. Often, the first step is simply monitoring, using regular imaging to make sure the aneurysm isn't expanding. When treatment is needed, there are effective options. Endovascular repair, where doctors place a stent or coil inside the blood vessel to reinforce the weak spot. Open surgery, where the weakened area is repaired or replaced with a graft. These treatments are designed to prevent rupture and keep blood flowing safely. The idea of an aneurysm can sound frightening, but understanding it is an important step toward reducing risk. Managing high blood pressure, not smoking, maintaining healthy cholesterol levels, and getting medical checkups when recommended can all lower the chances of developing or worsening an aneurysm. So, what is an aneurysm? It's a weak, balloon-like bulge in a blood vessel, something our bodies can often live with safely when it's watched and treated at the right time. Awareness, early detection, and understanding our risk factors are powerful tools for protecting our health. The more we know, the better prepared we are to take care of ourselves and those we love.